Hi students, welcome back to part 2 of our presentation entitled Making a Difference in Global Health. So we had left off on this one slide where I shared that I'd learned so much from my maternal and child health students as well as all my students from the refugee camp where I worked for 2 years in Thailand. It was really an exciting experience that gave me such an interest and such a passion. It helped me develop my true passion for global health. As I noted, there were many different refugee populations within the camp. These are a couple of them here. We encourage the different tribes to share their unique components of their culture with their instruments and their dance, etc. And there's a picture of, believe it or not, that's me in the lower left-hand corner with one of my students, Nia Lee, and I was dressed up in a Hmong wedding outfit. And believe it or not, the Hmong, the fatter you are, the more beautiful you are. So I had about 40 rags draped around my middle section to be as big as possible. And I looked pretty comical, but it's interesting that the larger you are, the more beautiful you are in the Hmong culture. I also worked with younger children I taught art to 5 and 6-year-olds. These are some of my students here. Took a picture out in the field. Beyond that is the lookout tower. They had armed guards and they were making sure no refugees escaped over the barbed wire that was behind that. The children in the refugee camp were so hard to leave. They'd follow me around everywhere. They all had siblings like these two in the lower right-hand corner, siblings tied to them in child carriers on their backs. And they would play and run around and they were just so adorable. I don't know what happened to those students because I left before the refugee closed. It's now closed. Everyone who wasn't accepted into a third country was repatriated back into their original country, which many of them may have been killed. After working in Thailand, I left to go to Columbia University, where I pursued my master's and doctoral programs. I had the intention of returning back to Thailand to work with Save Children in Cambodia. That actually never ended up happening. But I had that intention when I went to Columbia, and I finished up my master's in public health and also my doctorate, and I also served as an adjunct assistant professor for about 8 years while I was working in various jobs in New York City. As a graduate student, I volunteered with the March of Dimes, and through one of my graduate classes, I was charged with designing and implementing and evaluating a fictitious program. And I thought, well, I'd like to design a real program and implement it in a setting of where there was a need. So I found a Settlement Health Clinic in Harlem, 103rd Street in New York, and I designed a pregnancy prevention program for this population. And it was a peer mentoring pregnancy prevention program. And the program went really, really well. And the March of Dimes loved it. And from there, I created many more programs: a drug prevention, alcohol prevention, a violence prevention, a program targeting the children of domestic violence victims. I also worked with the domestic violence victims themselves, and I developed a theoretically based peer prevention program. And I had all these different programs and decided to turn it into a 501c3 nonprofit organization, which I called the Adolescent Health Alliance, or AHA. I was the president and founder. And it's a peer-facilitated health intervention program targeting inner-city youth that helps build and foster self-esteem and positive decision-making. And I created components that targeted pregnancy prevention, STD prevention, drug and alcohol prevention, domestic violence, and children domestic violence. I also created an eating program and implemented in health settings and in schools all over the New York City area while I was working. I did this in the evenings and on weekends, and it was a lot of fun. And this all grew from a class project. So I always encourage people to make the most of your projects if you can. After that, I worked with a fabulous program at the Centers for Disease Control and Prevention through the American Public Health Association. It was a 3-month internship or fellowship, sorry, and it was a great place if you ever get the opportunity to work at the CDC to understand so many different components of public health. I also interned with the New York City Department of Health and Hospitals Corporation in a Healthy Mother, Healthy Baby program, and I worked with a researcher in corporate nursing, and we were trying to understand why girls in Harlem were getting pregnant so young. So we were focusing on girls who were 9 or 10 who already were pregnant or had children. And we were trying to basically better understand what are the key factors that would lead to the pregnancies. My first real job was with Oxford Health Plans, and I was focusing on disease management. I developed their type 2 diabetes program, an infertility program, a women's health program. Anyway, I used all my the skills that I learned in graduate school, and I've worked on cross-functional teams, which I highly recommend. Always try to work in cross-functional teams so you have folks with different talents from a number of different areas. After that, I became vice president of an organization called the National Health Promotion Associates, and I worked on grant writing, particularly NIH SBIR grants. We were funded with 7 grants, which was really exciting. And I was director. I was also principal investigator, and that was a great experience. Once again, I used all my skills from graduate school. Then I decided to try the other side of public health. I decided to work with Pfizer in managed care strategic marketing. Once again, I worked in cross-functional teams, and we looked at all aspects of all Pfizer products, and my area was really business strategy. I stayed there for about 7 years, moved from New York City to Florida with Pfizer, and was commuting back to New York City, and until that just became really, really challenging. After I'd slept in so many airports, actually in the airports, I said, I've had enough of this travel, so decided to turn to teaching. I've always enjoyed traveling and meeting people from other cultures. My ideal vacation, I always tell people, is to travel to a place where I don't know the language, I don't know the culture, I have absolutely no reservations. I get off the plane and I have to fend for myself. That's my favorite thing to do. We just got back from Thailand, and although I did have reservations because I brought my children, I threw myself out there, and it's just so much more fun and exciting. We also went to Cambodia, and when you don't have reservations, it's really exciting. It's so much fun. I've also spent time visiting India, Eastern Africa, Europe, North, South, and Central America. Here's a picture of me with my husband. We summited Mount Kilimanjaro in Tanzania, Africa. This is one of the high points of my life. 19,340 feet high, believe it or not. This is us on the summit. My husband got sick going up towards the summit. I felt great. I told him I tried to carry him up the mountain because I felt so great. And as soon as he started feeling better, I reached the peak, and I felt like I was going to die. And I said, I'm just going to lie. After this picture, I said, I'm just going to lie down and take a little nap up here. And anyway, not such a good idea at 19,000 feet. And it took me 3 days to get down that mountain. 2 years ago, I organized a humanitarian trip to Cusco, Peru in the mountains to conduct a needs assessment in a rural village, which was really exciting. I brought a multidisciplinary team of colleagues from Florida, and we focused on 3 projects in Cusco, Peru. We visited a health clinic, as you can see right here, where we helped them improve their business strategy and come up with marketing programs. We also worked in an orphanage for special needs children, and they had just received funding for this new building. They're sitting here, and so we went and cleaned this building top to bottom, and played with the children for a couple of days. And we also, this was the most challenging day, was working with, these are all teen mothers. Many of them are 11, 12, 13-year-old with children. They had gotten pregnant. Incest and rape is fairly prevalent in Peru. And these young women had all somehow had children, and they were thrown out of their village, and they went to La Fuente, which is the health clinic where they have a connection with a homeless shelter for young women. And here they came to meet with us for 2 days, and we brought them clothing, and we hung out with them for a couple of days, and got to know them a little better and learn about their stories. And it was a challenging experience. I also had time to hike part of the Inca Trail. I got engaged on the Inca Trail 25 years ago, and I came back and was able to hike part of it. Last year, I went to Hamburg, Germany in the north to explore the refugee situation, to learn a little more about why so many refugees were fleeing their homeland. I wanted to really understand what were the key triggers, what was going on, and I did. This is one family here I met with their children. The husband went by water down through Turkey and across to Greece in a rubber raft, and the mother and her two children went by land and learned about their story, which was absolutely tragic. And I met with many of these refugees in their homes, and I also went to refugee camps. We met with teens, with children, and I met with many women in private groups in their homes, so they didn't have to be covered up, and just talked to them about everything that was going on. It was incredibly insightful. As I mentioned, my children loved meeting with the refugee children, and they realized that they all have the same needs, the same wants. They're all watching the same movies, playing the same video games, playing the same sports. They have the same toys, and everyone loves Snapchat, as you can see from this one photo here. So everyone around the world is basically the same. It's just you're born somewhere, and so these refugees were born in a bad place. And so it was insightful for my children. I also a couple months ago went to the Galapagos Islands in Ecuador, one of my dreams. Here's the blue-footed boobies, and these are some of the giant tortoises that are completely different on each of the islands in the Galapagos. I've also done goat yoga in Cape Cod, Orleans, Massachusetts last summer, which is really fun. This is my son. And here I am here with a goat on top of me, and goat yoga was really exciting. So what about global health here back in Jacksonville? How can you get involved if you live in Jacksonville or around? One thing I want to promote is the World Affairs Council, which has a partnership with UNF, and together they offer free speaker programs once a month on Tuesday evenings at the Herbert University Center at 7 o'clock. And I would love for you to go. I always have tickets, and this is an opportunity for you to get extra credit. As you can see, they're once a month. There's January, February, March, April, and May. The next lecture is January 15th at 7 o'clock with Lieutenant General Robert L. Carlson. He's a retired general, and he'll be talking about lessons from West Point. And after that, Tuesday is Global Healthcare. How good can we be? That's going to be an interesting one. March is about Russia. April is about political tribes. And that should be quite interesting. Also, there's an organization called Rethreaded.com, which is right here on Barnett Street in Jacksonville. I don't know if you're aware, but Florida ranks second in the nation for human trafficking, and Jacksonville is ranked #1 in the state. Last year, JSO rescued 55 survivors of human trafficking, 4 of whom were minors. And 92% of women trapped in prostitution said they wish they could leave if only they could. Rethreaded is a fabulous organization to get involved with. They have tons of volunteer opportunities. Go check out their website, rethreaded.com. World Relief's another great organization at worldreliefjacksonville.org. They're always looking for volunteers to help them with a variety of projects that help refugees adjust to life here in the United States. If you're interested, please reach out to me for extra credit. Another one is Lutheran Social Services, also here in Jacksonville. Here's their website up here. They are always looking for help as well. They focus on refugee resettlement, HIV/AIDS care, hunger care, and money management. Oops, I spelled that wrong. Jax Thrive is another new organization, about 2 years and growing. They are looking for volunteers on Saturdays from 9 to 1 to help mentor the children. They're also looking for people to run projects and help with grant writing if you're interested. And Kim's Open Doors, another one, also works with refugees if you're interested. And then finally, how can you get involved in global health? UNF have tons of study abroad opportunities. They've got programs through